Prime Minister Dickon Mitchell has revealed that government is exploring the option of transforming the General Hospital into a statutory body. This announcement follows the signing of an 18-month strategic partnership with New York-based Mount Sinai Hospital aimed at improving healthcare services in Grenada. During the initial 3 months, Mount Sinai will conduct a thorough assessment of the hospital operations, identifying areas for improvement. The remaining 15 months will see Mount Sinai experts working closely with local staff to enhance management practices and service delivery.
The government is considering whether it would be prudent to statutarize the hospital, not the health sector, because obviously the health sector is far wider and more diverse than that. This is something that, in fact, in my case, was actually suggested by young doctors and other healthcare practitioners when we consulted and met with them, when I met with them sometime last year. And they've given a number of reasons for that recommendation. They've also cited other countries in the region in which it has done and it has helped improve the level and delivery of services. And a part of it has to do with the fact that the public service is a one-shoes-fit-all type approach, which in many instances does not work for some of the very specific sectors that we have.
At a press conference on Wednesday, Prime Minister Mitchell emphasized that stakeholder consultations will be necessary before any final decision is made regarding the hospital's status.
But that is something that there would be obviously extensive consultations and discussions on. But ultimately, it is being considered, and we were happy to, in fact, have the suggestion come, certainly in my case, from those who are working in the hospital and who understand the challenges that they face and who obviously also perhaps have the experience of knowing what happens elsewhere in other islands, which would have had similar health care challenges.
When questioned about the potential impact on healthcare affordability for vulnerable population if the hospital becomes a statutory body, the Prime Minister had this to say.
NOASA is a statutory body. Vulnerable people are able to afford water. Grenada Solid Waste Management Authority is a statutory body. It collects garbage. Everybody pays via the environmental levy for the collection of garbage and so on. So one of the issues that we face with is that sometimes we spend a lot of money, but the impact and the outcome is low, and we have to find why. And oftentimes it is in the management and the delivery systems that we have that are not efficient. So it is not just about affordability. That's one. It's also about the quality of care. When you don't pay for things, freeness has a certain connotation to it, and that's part of the challenge we're facing here. Our healthcare sector is funded purely by taxpayers.
Brina Thomas, GBN News.